Welcome everybody. My name is Dr. Trav with Impact Physio and Performance, where we teach you how to alleviate your pain, bulletproof your body, and optimize your life through the most cutting-edge scientific principles of strengthening and mobility. So if you're new to this channel and ready to optimize your health, go ahead and hit that subscribe button. Guys, today we're diving into knee pain and the most common factors that we can fix to get rid of these nagging symptoms for good. So stick around. All right, everybody, let's jump right into it. First of all, fixing your knee pain is by no means a one-size-fits-all phenomenon. However, there are some extremely common characteristics of people suffering with knee issues. One of the most prevalent issues we see in the clinic is what we refer to as knee valgus. Knee valgus just simply refers to the process of your knees caving inwards. More specifically, your hip goes into what we call internal rotation instead of staying lined up correctly down the center. This creates unwanted strain on tissues that are not designed to carry that load. And eventually, that unwanted load is going to rear its ugly head up in the form of pain and/or injury. All right, so what causes this unwanted internal rotation of our hip? Specifically, it is weakness in a group of muscles called your hip external rotators. Makes sense, right? The name says it all. This group of muscles is responsible for externally rotating your hip or preventing that unwanted hip internal rotation. One of the primary muscles in this group is called your posterior gluteus medius, aka posterior glute med. One quick and easy way to determine if this muscle and this muscle group are weak is to simply perform a partial single leg squat. Let me show you how that looks. Grab onto something with one hand for balance, as we are not assessing balance specifically in this assessment. Then slowly go into a single leg squat. Only go about a quarter of the way down. If you feel the inside of your knee wanting to fall inwards, tension on the inside of your knee more so than on the outside, or you can visibly see that knee caving in, your hip external rotators are weak, and this is likely one of the primary contributing factors to your knee pain. The problem here is that if you perform this assessment in a controlled manner while being conscious of your body mechanics and you still experience knee valgus, I can guarantee you that this unwanted motion is also occurring all throughout your day repeatedly and undoubtedly during your workouts. Have you ever noticed your knee caving inward during a lunge or a squat? That is hip external rotator weakness at its finest. And this needs to be fixed if you are ever going to get rid of that knee pain and begin strengthening your lower extremities safely and appropriately. Don't believe me? Let me give you an example. Most of you are probably familiar with former NFL quarterback Robert Griffin III, more commonly known as RG3. Unfortunately, RG3 had clear weakness in his hip external rotators that was never addressed, and ultimately, this ended his career. If we take a look back at his NFL Combine footage, we can see he clearly goes into extreme hip internal rotation at the bottom of his functional movements. Well, he's an NFL player. He probably injured it when he got hit by a 300-pound linebacker, right? Nope, gravity hit him. That's right, I said it. RG3, a professional athlete's career-ending injury, happened from just the weight of his own body. Years of training improperly wore down the stabilizing ligaments in his knee, and as he was reaching down to pick up a fumbled football, those stabilizing structures gave way, causing a career-ending ACL-LCL tear, followed by reconstructive surgery. Guys, this was a truly heartbreaking injury that possibly could have been prevented. So my job is to not let that happen to you. So here's what we need to do about it. So we're going to begin by doing some neuromuscular re-education to that muscle group. Essentially, we need to wake those muscles up and get them firing again. One of my favorite exercises to get this accomplished are called clamshells. These are a very common exercise in the physical therapy world. However, they are also very rarely done to perfection. Well, we're going to fix that today. Begin by lying on your side with your knees bent at a 90-degree angle. Your heels should be lined up with your glutes. Then you simply separate your knees while keeping your heels together. The natural tendency here is to just roll backwards. Do not let that happen. One trick I like to use to combat this is to tilt your hips downward toward the floor and place one hand on your lateral pelvis to help check any movement. Your pelvis should not move at all. Now, separate your knees again without letting your hips roll backward whatsoever. Continue this for approximately 10 to 20 repetitions. To make this exercise more difficult, progress to a resistance band around your knees. You should feel a nice burn right here in this region after putting that band on. If you don't feel this burning, you're not doing it correctly. Have fun with this, guys. Your posterior glute med should be absolutely on fire after this one. Now that you've learned how to recruit your hip external rotators, it's time to add in some exercises that are a little bit more functional. Stand up now and place the TheraBand around your knees. Get into an athletic stance and begin to perform what I like to call mini side steps. The key here is to not allow your knees to cave inward throughout the entire exercise. Try to maintain your knees directly above your ankles, even though the band is trying to pull them inwards. If that is too easy, place the band around your ankles to increase the amount of resistance. Continue this exercise alternating directions until you begin to feel yourself lose proper form. Then rest and start another set when you're ready. I typically have my patients go for about 5 minutes on this one with rest breaks as needed. Then you can step it up a notch with what I like to call monster walks. Apply the exact same concept with monster walks of not allowing the band to pull your knees inward. However, this time you're going to step forward and laterally at about a 45-degree angle. Again, those hip external rotators should be feeling a nice burn at this point. Don't freak out, that's exactly what we're looking for. Perform these exercises every day until you can perform a partial single leg squat without that knee caving inward. Don't attempt the single leg squat right after completely burning out these muscle groups, as fatigue will likely contribute to improper form. Allow that muscle group some time to recover and reassess when your legs are fresh or after a short sub-maximal warm-up. Now, once you've got your knee pain under control, it's time to apply these methods to the higher level functional movements like squatting and lunging. Perform your squat with appropriate weight and assess for knee pain and knee valgus. I like to use a mirror if possible so you can keep an eye on that knee position. A great tool you can utilize if you are still seeing some mild knee valgus down at end range is to place that same TheraBand around your knee during your squat. Think of this like a track athlete who trains with a parachute. Yes, it is much more difficult to run with a parachute. However, once you take that parachute off, the task becomes much easier. We are applying the same principle here. If you can squat correctly with the band, your squat will start to look phenomenal without the resistance. The split lunge or walking lunge is another exercise where it is very common for people to demonstrate weakness in this muscle group. As your front knee goes into that 90 degrees of flexion, it should be directly in line with your second toe, not caving inward or lined up with the inside of your foot. Be very conscious of this as you perform this exercise so that you can distribute the pressures through your knee appropriately. If you are able to self-correct during the exercise, great. If not, it's time to get back to the clamshells and TheraBand exercises that I showed you earlier in this video to strengthen this muscle group before moving on to the more challenging, dynamic exercises like the walking lunge. It's always best to master the fundamentals before progressing on to higher level activity. So that's it, gang. The key to fixing one of the primary causes of knee pain. Take it from a guy who has had enough knee surgeries to last a lifetime. These principles and exercises have been an absolute game changer. I've had 3 major knee surgeries from sports-related injuries, and I am certain that 2 of the 3 of those surgeries could have been avoided had I addressed the issues that I just shared with you in this video. Now, my knees are back to 100%, and I have literally 0 limitations. I play basketball, climb mountains, ski, chase my pup around, you name it. However, none of that would have been possible without the specific strengthening that I did behind closed doors that I just shared with you right now. Guys, thank you so much for checking out this video. Now's your chance to smash that subscribe button to get more tips and tricks on how to optimize your health. Stay safe, and I'll see you in the next video.